I'm Professor Gilles Montalescot. I'm a cardiologist, professor of cardiology at Sorbonne University in Paris, and I work at Pitié-Salpêtrière Hospital. And I'm the president of the Action Study Group, which led this study. First, we have to understand that atrial arrhythmia is a problem after PFO closure. It's probably the most frequent complication for these patients. In the randomized trials, it has been reported to occur in 5% of patients globally, but it is totally underestimated, underreported. And when we look at studies with long-term monitoring of the electrocardiogram, this number can go up to 20 or 22%. So it's a frequent complication. And of course, it exposes the patient to stroke and complications of fundal regulation, re-hospitalization, and so on. So what we wanted to do is to see if we could prevent this complication by the use of flecainide, which is an antiarrhythmic drug effective in the conversion of atrial fibrillation, and which could be used in the prevention of atrial arrhythmia. So this is the whole idea of this study. So what we wanted to do is to recruit the patient at the time of PFO closure, and in the same setting, when we close the PFO, to insert a monitor of the electrocardiogram for a long-term follow-up of this patient. So they would be monitored for the electrocardiogram permanently for several months. And knowing this, first we would answer the question, what is the real incidence of atrial arrhythmia in these patients? There's still a question mark about it. And second, by randomizing these patients to flecainide or no flecainide, is this drug effective to prevent these annoying episodes of arrhythmia, exposing the patients to more complications? So we calculated that we needed roughly 186 patients to answer the two questions. So the primary endpoint of the study was pretty simple. It was any atrial arrhythmia of more than 30 seconds occurring during the first 3 months after PFO closure. And this is a definition of the guidelines for the fibrillation. So it's something that everyone knows. Of course, the question is that isn't it too short, 30 seconds? So we looked also at episodes of 6 minutes, which is a secondary endpoint. And what we didn't know when we started is the duration of treatment that these patients may need. Is it 1 month, 3 months, 6 months? So we have two arms in the study. One arm is being treated with 3 months of flecainide. The second arm is treated with 6 months of flecainide. And the third arm is the control group without flecainide. So the findings are quite interesting. First, we confirmed that this complication is quite frequent in this patient, because what we observed is a 26% event rate at 3 months of atrial arrhythmia. So it's 1 in 4 patients with an atrial arrhythmia after PFO closure. The second point is that there was absolutely no effect of flecainide to prevent these episodes. And this is very surprising, because the drug has been shown to be effective to convert AFib, but here to prevent AFib in these patients after PFO closure, there was absolutely no effect. And this is the answer to the primary question of the study. The second question was about 3 months versus 6 months. And again, between 3 months and 6 months, there were very few events, and flecainide was not effective either. An important point is that almost all the events, 90% of the events, occurred during the first months after PFO closure. After that, it's completely flat, almost no event. So it's kind of an acute complication of the first months after PFO closure that cannot present with flickering eye. First, it tells us that we need to say and explain to the patients that they may have atrial fibrillation in the first months after PFO closure. In general, we don't say that to the patients, but it's so frequent that they should know it. And if something happens, they feel something wrong in their chest, it's probably atrial fibrillation. And they should come back to us just to check how is the rhythm and possibly change antiplatelet therapy to anticoagulation treatment, because this is what we want to do to prevent a stroke in case of AFib. So next thing to know is that we have no way to prevent this atrial arrhythmia response. The only thing that we show in this study is that there are factors that predict quite well the occurrence of atrial arrhythmia episodes. First, age is an important one. Older age is associated, even if it's a young population. Older age is associated with more frequent atrial arrhythmia episode. BMI is also associated with these episodes. And third point is the size of the device. The larger the device, the more frequent these episodes occur. And when we know that, we may identify a group of patients particularly exposed to the risk of atrial arrhythmia. And they should be sensitized to these waves. Now, can we prevent it? So far, I don't know, and nobody knows. We have no clue for that. Clearly, it's probably not re-entry circuit, because flickering eye would have run. It's probably the stretch in the atrium, possibly inflammation. And after a month, this stretch and inflammation go away, and the risk is away also. So while waiting for new strategies to prevent atrial arrhythmia episodes, the only thing we can do is to identify the patients at risk and tell them that it may occur. It's something to know, and they should come back to us to try to get anticoagulation. The paper is online now, and you can read all the details of the study in circulation.